Hi, everybody. My name is Kathryn, and I'm just sharing my screen. So this is my journal club presentation. It's on the article titled Whether a Gluten-Free Diet Should Be Recommended in Chronic Autoimmune Thyroiditis or Not, a 12-month follow-up. This is the reference down here. Okay, so you may first be asking, well, what is the difference between primary and secondary hypothyroidism? The focus of this presentation will be on primary hypothyroidism, which is when the thyroid is directly attacked by the immune system, causing dysfunction and altered lab values with the presence of thyroid antibodies. There are many names for this, including Hashimoto's disease, Hashimoto's thyroiditis, and chronic autoimmune thyroiditis, to name a few. In secondary hypothyroidism, the etiological problem begins in the brain, a secondary location to the thyroid. So in this presentation, we'll be focused on primary hypothyroidism. Hashimoto's is so in Hashimoto's disease, we see thyroid antibodies attacking the thyroid, which you can see depicted in this slide. Here are the thyroid antibodies, anti-TG or anti-TPO, and this is the thyroid. Typically, we see TSH values are from normal to high, and FT4 and FT3 are from normal to low. Sometimes FT3 is low, it's not as common, but it can also be seen as low. So gluten has been investigated as a trigger before. This slide depicts the multisystem disorder in Hashimoto's thyroiditis. We can see impaired intestinal permeability, which is a hallmark of hypothyroidism, with tissue damage and an autoimmune cascade that reaches multiple organ systems via gluten and gluten peptides like gliadin, stimulating the production of various antigens. So here are the antigens that I'm talking about here. This image was produced by a registered dietitian that specializes in thyroid diseases. Her name is Nicole Morgan. And I just wanted to show like kind of what's going on and what is really the problem here. So there's a question as to whether gluten is a trigger. So the objectives of this study, let's see if I can get to the next slide. So the aim of the study was to investigate whether a gluten-free diet in Hashimoto's thyroiditis can lead to an improvement in terms of immunological and hormonal parameters. Key features of the methodology of the study includes this prospective observational design. This study was randomized and controlled with a gluten-containing average Pole diet or Polish diet. The duration was 12 months. All participants included in the final analysis, the sample size was 62, were on levothyroxine, and participants were exclusively Caucasian women in Poland. This tidbit about restricting the study to Caucasians makes it irrelevant to our case study patient who is native Indian. Other factors that are irrelevant include the lack of extensive statistical analysis to determine magnitude of risk, precision, and association strength in the study. These answers were combined in the JAMA worksheets, which I will show at the end of the presentation. Adherence in the exposure group was measured using questionnaires administered by trained dietitians. ELIAS was used to measure serum concentrations at baseline, 3, 6, and 12 months. Parameters investigated included TSH, FT3, FT4, anti-TPO, and anti-TG. Anti-TPO and anti-TG are the thyroid antibodies that are in question. So here's table one. Indicated by the star at the bottom down here, we can see that the exposure and the control groups are not statistically different, which is indicated by a large p-value over 0.05. So yeah, so these are characteristics about the study group or the people that were included in the final analysis. This table shows the median concentrations of all parameters investigated at baseline, 3, 6, and 12 months. Confidence intervals are narrow for thyroid hormones, which are depicted by the first 3 rows at the top, and they're wide for thyroid antibodies. The only statistical significance indicated was in TSH values at 12 months, and this is before logarithmic transformation. This table shows changes in median concentrations with confidence intervals in the parentheses. At 12 months, there were significant changes in FT4 and TSH. FT4 increased while TSH decreased, which is what we want to see happen. So positive changes, and those were statistically significant. Okay, after logarithmic transformation, separate analysis for the control group and the gluten-free group showed a significant decrease in anti-TPO concentrations after 3 months and anti-TG concentrations after 3, 6, and 12 months of gluten-free diet, and significant reductions in anti-TG concentrations at appointment 3 in the control group. In the gluten-free group, there was a reduction in TSH concentrations that was observed after 3, 6, and 12 months, and an increase in FT4 concentrations after 6 and 12 months. And I just want to point out that there are p-values that are at 0, so for FT4 and TSH, which is excellent. This is good data for us. Okay. So the author's conclusions are on the left in the purple box. Individuals with chronic autoimmune thyroiditis should be tested for other autoimmune diseases. A gluten-free diet may be recommended after ruling out celiac disease. More studies are needed exploring gluten-free diets as an intervention for chronic autoimmune thyroiditis. And some limitations to the study included that all participants were on levothyroxine and adherence was not measured in the control group. A fun fact about this study is that it mentions that a gluten-free diet actually improved levothyroxine uptake. So potentially that's a confounder, obviously. The clinical bottom line that I show at the right of the slide are the groups from our JAMA worksheet. So firstly, gluten-free diets are certainly beneficial in chronic autoimmune thyroiditis protocols, particularly for hormonal health and improving thyroid functionality. The high levels of adherence to the study's exposure contributes to the feasibility of this study in a practice setting with present clinical and nutritional monitoring. It is also important to note that a gluten-free diet seems to improve the uptake of levothyroxine. This is important information for obtaining adequate disease control. A logarithmic transformation to this study seems to also show that there may be hormonal and autoimmune response benefits as well. Other nutritional components need to be evaluated in relevance to a gluten-free diet's relationship to autoimmune thyroiditis. Clinical advice to avoid nutritional imbalances while in diet is necessary, and assessments such as celiac disease, treatment use, dietary adherence, and more. More studies with various variables of diversity are needed to have more generalizability. This study contributes to evidence about how prospective studies on the topic should have an appropriate duration, at least 12 months, to ascertain whether this type of intervention is effective, as the changes that were seen with significant p-values, some of which were 0 in Table 4, were statistically significant by that point. So, big takeaway is that these studies need to be longer in duration. And then I just wanted to show off our JAMA worksheet. So here you can see the citation, you can see our PICO or exposure comparison outcome population. Are the results of the trial valid? Here you can see some answers that we put in, as well as, you know, a collaboration between me and my partners. And yeah, and then this is the other part of the JAMA worksheet. Then I'm just trying to go to the thank you slide, but thank you.